Hello everybody. I just thought I'd put this tutorial together to just give you a bit of feedback around the first assignment. I know you haven't got your results back yet, but I thought if we could start and just talk about what we found and give you some pointers about the assignment, and then to just give you some ideas about your second case study and information that might help you in writing your essays now and into the future. So just to recap, the essay was to look at the list of pointers that Bryant and Nuts had for do no harm in terms of choosing your right medication for the right person. What we asked you to do was to look at one condition and that you most commonly see in your practice, and to discuss the therapeutic plan that you would develop using the guideline provided. So the first thing I want to just remind you is that the whole reason why you're doing this, you're learning in this topic, is about the pharmacology. So it's about applying information that you have on clinical practice, on pathophysiology, and the clinical assessment that you're going to do, with reference to the kind of medications that you want to give this person, the appropriateness of that medication, what's going to happen to it, why is it going to happen to it, how is it going to happen to it. So I take you back to what we did in the first module, and that's the list of information that comes out of Bryant and Nuts that talks about the various stages of what happens to the drug once it goes into the body. So you really need to go back and think about that, and at every point ask yourself, what do I need to find and look for in a patient? What kind of assessment do I need? What do I need to know about the person, what's happening in terms of the condition, and how the drug is interacting with the patient in terms of everything about the drug, the absorption, the assimilation, the distribution, the effect of it, the response to it, and the therapeutic efficacy of it. So just remember that, and that's a very simple table. You can't go wrong if you keep that table in your head all the time. Well, it's not a table, it's a flow chart. So when we look at the do no harm factors that Bryant and Nuts talks about, the first thing they say is, when you're wanting to prescribe, what is the problem? So you don't just go rushing ahead and thinking about drugs just because somebody else has decided that that's a kind of drug. You've got to look at your patient. What is the patient? What is the condition? What assessment do I need to do to get the right information about this patient that will support me in actually choosing the right drug in the right dose for this person? So you have to do the assessment. You have to understand the condition. You have to understand the pathophysiology of this condition. How does this condition respond? How does it work? What happens to the body when this condition is impacting on a normal working body? So it's changing the way the body responds to things because it is a condition that is making the person not well rather than well. So you've got to come up with the diagnosis. You've got to know that that's what it is. And then you've got to consider the factors that are going to be part of that as well. So for example, the patient may have previously had chemotherapy, or may have had immunosuppressive drugs of some sort, may have other comorbidities that impact on how they are responding or reacting to the condition that you've chosen for this particular essay. So once you've come up with the condition, you understand the pathophysiology of it, you understand the situation that the person's in, so you've picked up all the personal information that will need to occur so that you understand where this person's at, and that includes their ability to understand what their condition is and what the drugs are going to be that they take. And the best way to do that is to ask the patient, do they know why they're here today? Do they know what kind of problems they're experiencing at the moment? So then Bryant and Nuts talks about, is there a solution? And a lot of you picked this up really well, which really pleased me to know that you were looking at other alternative therapies and diets and exercise and alternate over-the-counter medications, and what patients had taken already and what they hadn't taken. You were including the cultural factors in there as well, which was really good. You also need to talk about the fact that they could be on other medications. so you need to put that in as well. So remember that some of you actually all chose your condition, but some of you chose to talk about a particular patient without actually naming that patient. Either way, we've accepted that approach. Remember, with a condition, you've got to still picture a patient. Well, I found the best way to do it is to picture a patient in your mind and think about all the things that happen to that person with that condition, and then think about what you've learned in terms of the pathophysiology as well as the condition, so that you're painting a picture in your mind about the person that you're talking about when you're looking for a solution to their problem. So when you come up with the sort of drug therapy that you're thinking about, and obviously that's the most important part of this whole essay, is because you are learning about medications and prescribing. So what is your drug of choice? Why have you chosen that drug? What is the evidence for supporting that drug in that particular condition? Is it appropriate, or are there other alternatives? And if there are other alternatives, why haven't you chosen those alternatives? So those are the sorts of things we were looking for when we talked about what sort of therapy. And this is Bryanton Knights talks about that when you read through what they do there. So then how would the drug work? And this is where your pharmacology knowledge has to come in. So it's the dose, it's the route, it's how it goes into the body, how it's distributed around the body, how it's actually taken in, what it does in the body, how it's excreted, what is the clinical response that you're expecting from it, what effects are you expecting it to have, and are there any precautions and tolerance factors that you might need to consider before you actually offer this drug to this person. So there we're looking for the right information. So some of you fell down on this by just regurgitating, for want of a better word, the MedSafe information. But you'd forgotten that your patient was either 90 or 9. So the life factors changes had to be put in place. You talked about precautions in pregnancy when your patient's not pregnant. Remember that, yes, we can actually talk about the drug in total, but we're talking about the condition and the lifespan. If you've got a whole lifespan, for example, an asthma drug, then clearly you need to add all of the lifespan information in. But if you're talking about a drug that's predominantly used in a particular condition that you may see more of in the 65 and over or whatever, then you need to really consider those sort of factors as well. So it's got to be appropriate to the scenario that you've actually chosen. How long would you treat with this? Well, evidence-based practice comes into it, of course. What's the evidence say? What's the research say? Is there any debate that's going on out there about this particular drug? And that's where your critical thinking comes in, and your critical analysis, and reading widely about the actual drug itself, and not just accepting MedSafe or one of these other support mechanisms that are out there to just give you the information you need. What kind of patient response are you looking for? What interactions are there? What do you think you need to think about? And what are the intolerance factors that you might have to look at? And this is where the comorbidities of the patient and previous allergies and existing medications will need to be considered. And if you haven't actually chosen a patient per se, you've got to talk about these things as, like you were saying, if this patient had this kind of comorbidity, or if this patient was on drugs related to that other particular comorbidity, I would be considering whatever it is in terms of the interactions between the drug that I'm about to give and the medications that this person may well be on in their other comorbidity areas. How will you monitor the drug? Well, it's, all the way through the semester I've talked to you about, and I've dropped information in around patient assessment. You can't assess your patient enough. You give a drug that's going to change the way the person's going to behave, or the condition's going to behave. You're going to get symptoms which you need to watch. Whether those are positive symptoms or negative symptoms, it doesn't matter, but it's the symptoms you're going to look at. What are you expecting to happen to this patient? How will you know it's happening? What kind of monitoring will you do? How often would you do this monitoring? So, for example, if you're going to give an antiarrhythmic, you're going to monitor them in hospital for the first 48 hours or whatever the case may be. you're going to make sure that they understand that, you're going to make sure that they have follow-up, and you're going to do the blood pressure and all the rest of it. A lot of that you didn't, quite a few of you didn't actually even touch on. So those are the sorts of things we're looking for. How much of the drug will you give? Again, it's evidence-based practice. And I don't want to hear things like, well, it's in the guidelines from Christchurch DHB or Hawke's Bay DHB or whatever. What's the information say out there? What does the peer-reviewed information say? You know, I get that the guidelines that you have in your hospitals hopefully are up to date, but I have seen some guidelines that are not up to date. So you've got to be cognizant of that. So you can say something like the Christchurch guidelines are peer-reviewed and they're up to date, therefore we use them and this is what we do. However, there are other instances where medication can be given at this rate or that rate based on information that comes out of the research. So we know that you've read more than just your DHB guideline or MedSafe guideline. And again, what are the special considerations that you would be doing? So, for example, if you've decided that a drug is going to be used that can be given IV and it can be given oral route, you'd be saying, well, in some cases you'd give it orally. Why would you give it orally? When would you give it orally? Likewise, IV, when, how, and what's the dosage? Quite often IV is calculated at milligrams per kilogram, and that wasn't particularly well done. So you've got to think about these things. What's special about your patient? Well, age is very important, comorbidities, current health status. If they're very debilitated, they're emaciated, they've not been eating very well, you know, they're not going to respond in the same way as a person who's just started getting ill with this particular condition and is fit and healthy in other respects. So these are the sorts of things you've got to think about. You know, in your response to it, you need to consider, well, in renal failure, in renal function rather, you'd be looking at checking that in an elderly person or a person who's been immunosuppressed or a person who's quite debilitated. You'd be checking it. If it's a drug that is predominantly excreted in the urine, you're going to be checking to make sure that the renal function is good, etc., etc. Some of you did that quite well, some of you missed it completely. So previous medications are also important because of the interactions between drugs, and that didn't tend to be noted as well. And again, when you've got lots of comorbidities, there will be drugs and they will have a polypharmacy and they will have a packet of medication that they come in with. What is interacting with what? And if you add this drug, how is that going to affect other drugs? Think about these things, and you've got to consider these in your prescribing practice. And allergies, you know, and quite a few of you missed out that you would check for allergies before you actually gave any drug. Ask the patient if they've ever had this drug before, if they're allergic to anything in particular that might affect the way this drug is actually going to work with these people. So these are all the things that we would expect you to have written in your essay. So I didn't want something that just came straight out of the guideline. I wanted you to consider what you would do, how you would think it through, what would you think through, what kind of information would you be looking for, what kind of monitoring, and so on, which all fits under Bryant and Knight's Do No Harm, prescribing practice safely, making sure that what you're giving this patient is going to be safe. If it's a drug that's not well used, or if it's a drug that you know there's a lot of side effects, how are you going to make sure that this person is going to be managed carefully? So we come to, can you write the prescription? And of course all of you say no, because you can't. But that doesn't stop you from saying, but I will be monitoring this patient, and I will be checking on the blood pressure and the symptoms, and I will be alerting the doctor to these things because I have this knowledge, which is more than the knowledge of other people on the ward, because of where you're at with your prescribing. You're advancing practice, and you're actually going more than do no harm in terms of the right patient at the right time with the right dose and the right drug. We want more than that. How are you going to manage this? How are you going to education and support others on the ward or others in the community setting and so on? And that likewise is warning for the patient or staff. The patient education is really important. What to look for, how to look for, when to change things. And most of you did this quite well. And again, for staff, if you've got a new drug on the ward and staff, you might have some junior staff, how will you actually make sure that they understand what's going to happen? So all of these things you should have actually considered when you're looking at this, this essay. And it is about understanding your assessment of a patient, understanding the condition of the patient, as in the disease process of the patient as well as the condition of the patient, your ability to understand and come to a conclusion around what kind of monitoring you need to do in terms of the therapeutic plan for the medication you're going to introduce. It's all about preparing you for safely practicing at an advanced level, whether or not you prescribe. And I just want to remind you that it is in your Nursing Council Expanding Practice. It is part of your Code of Conduct and your Standards of Practice. So even if you're never going to prescribe, the ability to actually share the knowledge that you're going to be gaining from learning about these drugs and how to manage them is what's going to help you in terms of supporting others around you and also in keeping your patients safe. And that's what this course is all about. So that's the clinical side of things and the therapeutic medication side of things. Generally, language and writing was not very well done. There were some of you who wrote really well, and I was so impressed with the reading and the structure of your essay and how you approached it. Others, I think you were very focused on getting the information down, and I think some of you did quite a lot of copy and paste and then tried to paraphrase, and I'll talk a little bit about that in a minute. But when you're writing an essay, it really is worth reading it out loud, because you'll realize that you've made some silly mistakes. And even people who are writing for publication and PhDs and like myself, and the best information I ever got from my supervisor was to hand my PhD over to somebody who's not a nurse, who's not an academic, and if they can read it and get to the end and understand what I've written, I've done a good job. That is what I would like you to do. Don't try and use big words. Don't try and be what you're not, but make sure that it makes sense, that the sentences link. So many of you just put a sentence in that didn't even have a verb sometimes, and then a full stop. It didn't lead to anything. It didn't give us any information that suggested that you understood what you were even writing. So just be very careful with the way you write things when you write these essays. And I do understand that your stress levels are around trying to get the clinical aspect of it in, and so you forget the writing aspect. But as I say, read it out loud. You'll soon change what you've done sometimes. It's quite a leveler in terms of reading it out loud. Let me tell you, I still do it with some of my stuff, and I still cringe at what I've written. So please take that on board. So I just want to go through some pointers for you in terms of a good essay. And you've got to really think about it. You can't rush it. And every person has a writing style of their own, and it's something that is practiced. You don't just have the writing style like that. It doesn't just happen. You grow and develop it as you go. I mean, when I look back on even my master's thesis and I read it, I cringe at what I wrote, because my writing style has changed so much since then, because I've had practice. Practice makes perfect. So when you think about it, you're beginning your practice at writing essays. So you've got to really sit and think about it. So these are the pointers that I've put for you. So first of all, what is it that you're being asked to do? Have a good understanding, a clear understanding of the essay or the question that has been put to you. Make notes on the question, highlight it, scribble things around it, and pick out the main points. So that's when you have an essay plan. So highlight the points that are really important, and then plan your essay. What needs to go where, and how do you want to put it? And scribble around, do some notes, use sticky pieces of paper, whatever you need to do to actually make notes and to get a logical sort of flow of what your essay needs to look like. Read around the subject, whether it's pharmacology or whether it's Foucauldian information or whether it's condition information, whatever the case may be, whatever the essay topic is, read around the subject. This is evidence-based practice. This is doing the research. This is using critical analysis, picking up things and arguing the point and having a look at what's out there. What are people saying about the subject? Is it relevant to you? Is it not? If it's relevant, then you can discuss it. If it's not relevant, you can also discuss it, because you can argue the point around it. And that's what master's program essays should look like. You shouldn't be afraid of making a point that is against the point that's being made, and arguing the case. But you've got to actually argue the case soundly and using other evidence to suggest it. So it's a bit of a practice makes perfect there. But when you read around the subject and you decide that you want to use some of that information, don't just drop it into a paragraph and then leave it. You've got to actually understand the points that are raised. Sometimes when we read essays, and when you've read as many essays as we've read, you pick up the points where people have dropped something into a paragraph without necessarily understanding what they've written. So my answer to that is to make notes about it. Does this mean anything to you? Can you actually close the book, or close the piece of paper, or close the journal article and paraphrase some of the things, or make points of what you've read in there, and does it make sense to you? So write the essay in your own words, and that's the other thing that is really important. I know that with pharmacology information, sometimes it's really hard to write it in your own words without looking at the piece of paper. But generally, I usually say to people, read the article, then write it in your own words, go back and put the references in based on the information that you've read. Because trying to copy and paste and then re-paraphrasing it and changing words, you just get yourself into a muddle. With the pharmacology information, sometimes, you can't find a different way to write it except that. So then put it into a quote and put a reference around it, and a page number. So be clear in your points. Don't add information unless it's important. So you write waffle, and I say waffle in the kindest way. You write a whole lot of information around it, and then you lose track of what you're trying to say because you're trying to explain yourself too much. And when you read things out loud, you'll pick that up very quickly. You'll read you read what you think you've written a really good paragraph, and I do this all the time, so it's not just you. And then you read it and you think, oh my word, that doesn't make a whole lot of sense. I have to go back and redo it. That's when you're trying to add more information to get the critical thinking, to get the analysis, and you're trying too hard and it doesn't work. Take the information out. If it doesn't say anything, take it out. So in summary, you need to analyze the question, introduce the topic. There always needs to be an introduction. What is this essay about? What are you going to be telling the reader? So think about telling somebody who's never heard about pharmacology in their lives, or whatever the case may be with the essay. What is it that you're going to tell them about? Give them an overview of it. Then present the argument. This is what I'm going to talk about, and then present the argument, provide the evidence, discuss the issue, summarize it, critique the points, and always write a conclusion. Then return back to the question. Have you answered the question? If you haven't answered the question, then you need to go back to basics again. And what I find is the best way is to have the question right up front, and then at every point go back and say, well, does this refer to the question? Does it relate to the question? If it doesn't, remove it. So when we look at an assignment preparation, do you understand the question? Underline the important points, which I said in the beginning. Draw up a plan, introduction, body of the work, conclusion. What headings do you need, and what headings will help you in the work that you do? And then find the information that you want. Read widely. And that takes practice as well. Remember that sometimes, and all of us do it, you pick up an interesting piece and you go off at a tangent, and then you've forgotten what your question was all about. Go back to the question. What was my question? Is this going to answer my question? So I always say do 3 drafts. First draft is write it in your own words. The second draft is add the relevant references, check the information that you have and if you want it based on the question. Third draft, critical appraisal. Have I answered the question? Have I paraphrased the information? Have I referenced it properly? If I read it out loud, does it make sense? Have I provided enough critique? And those are just some pointers for you. Avoiding plagiarism. Plagiarism is a very big thing, and It's a misconduct in academic writing to the point where even us as academics, if we are caught plagiarism, we lose our jobs. It's serious stuff. It's like borrowing somebody's car and going down the road and saying, look at me, I've got a new car, it's my car. You know, it's theft. This is theft of other people's work. And I can't stress it enough. If you can't paraphrase something, reference it. Put it into parenthesis, reference it, put a page number. It's okay to reference, but it's not okay to reference every single paragraph without discussion, because then it means that you've just copied and pasted and you don't really know what you're saying. So, you know, just be careful. As I say, reading it out loud actually helps a lot. So plan your assignment. Make notes on what you want to write about. Write in your own style. Nobody's going to stop you from writing in your own style as long as it makes sense, as long as it reads well, as long as it's logical and methodical in the way you've approached it. Write in your own words. Add the reference afterwards. But my point there for you is to make sure that you have a list of the references and you've highlighted some of the information that you know you're going to be referencing or using in your information. When in doubt about something, cite it. Parenthesis, page number, reference. Who said what? Be clear. So many times we get essays that have got a whole stack of references, and when we do a spot check on the references, they have nothing to do with what you've written. And they've just been put there because perhaps it's been at the end of a journal article that you've seen or whatever. Don't do it. We are able to pick that up quite quickly. Does the reference support the argument? If it doesn't, take it out. Don't keep it in. So again, points for plagiarism: paraphrasing, analyze, reflect, evaluate, read your essay out loud, check your references, put it through Turnitin. Just remember that Turnitin won't look at tables and pictures and diagrams. If you've got tables, pictures and diagrams, you need to reference them and put a title to them. So what do we mean by critical thinking? At master's level, you really need to ask yourself, why are we doing this? What are we doing? How's it working? How can we make it better? And what is out there that we have to debate and discuss? Remember, critical thinking is about discussing something, having a look at what other people are saying about it, and then drawing your own conclusions based on the facts that you're putting in front of you. So conceptual thinking, analyzing the facts, evaluating the information, exploring the debate, looking behind what we see, that is critical thinking. Another way to put it is balancing the scales of information for and against, or developing the argument and evaluating the opinion. It's the ability to look outside of the box and to understand the facts in the broader sense, then jump back in the box and assimilate it all and put it together for the discussion that you're talking about on your particular subject. So in a nutshell, how do you think critically? Identify the problem, build the argument, examine the literature, argue the points using the evidence, summarize the claims, and draw a conclusion. Remember, if it's your opinion, say so. Don't make statements like Augmentin is not used because it's got a whole lot of side effects, full stop. How do you know this? In my opinion, Augmentin, I have seen a lot of patients or a significant number of patients who have had side effects based on Augmentin. However, in the literature, and you can quote a few people, it is suggested that if they take Augmentin on a full stomach or an empty stomach or whatever, it's full stomach, I think, if I remember correctly, then they won't have as much nausea and vomiting and so on. So it's about actually making the argument. Okay, in my opinion, there has been a lot of nausea and vomiting with Augmentin. However, in the literature, this is what it says. Da, 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 da. That is critical thinking. That is discussing the various points of view about a topic that you're talking about. Then you can come to the end of it. So if you're having a discussion around the type of drug, for example, in the essay that we've just done, the type of drug you're going to use and why you've chosen it for that condition, all the way through you will have drawn on literature that says this drug is good because of that, but however, if there are interactions or side effects of this drug, this other drug can be used. However, I'm not going to use it because of this, and this, whatever your case may be. Summarize the claims. I'm using this drug because the evidence suggests that it's the most effective one in this particular case in older people with renal dysfunction, or whatever the case may be. Draw the conclusion. You know, this essay was about cardiac failure and the use of digoxin in a typically an older person or whatever. This is what happened. Now, I would like to add the reflection there. Some of you didn't reflect very well. Some of you reflected extremely well. How do you write it? Again, reading widely around the subject. Discuss it, you know, and I see some of you are in study groups together. Discuss the drugs. Discuss the information that you have. Read the signposts. What are you seeing with this drug? What is the general population? How often is it being used? What sort of information have you got out there? What is your experience on the subject? Think about what you've read and then summarize the main points and then look at your practice. In my practice, this is what I've learned, this is what I've used, this is how I've used it, this is what I found having done this essay. This is what I've found in my practice, this is how I'm going to change my practice based on the information that I've seen in this essay today. That's all you need to do. So having gone through all of that, case study 1 draws in everything that I've talked about now, because now you're going to take this patient and you're going to tell us about this therapeutic plan that you're going to develop for this patient, and what you're going to do and how you're going to do it. So go back to module 1 and go back to that simple flow chart about drugs and how they come into the body, go around the body and get out of the body, and the effects that they have in between. The pathophysiology, the condition, what happens with the condition, what are the general signs and symptoms, what is the pathophysiology, how is that going to respond to the drugs, what other interactions are there from comorbidities, what's the age of your patient, how does that affect the drug. Remember, this is a pharmacology assignment, but it draws in your ability to assess your patient, to come up with a diagnostic reasoning, to come up with a diagnosis, and to manage a care plan of pharmacology and drugs based on the information that you know about the drug, you know about the condition, you know about your patient. If you do those simple things, you can't go wrong. Now, the rubric for this particular assignment is up on EIT Online, and I've made it quite clear for you there, the marking criteria and the information that we're looking for. And my advice to you is to go through that, then go back to module 1, go back to the do no harm information, and think about your assignment. Think about how you're going to write it. Think about what you need to put in there. I hope that's helped you, and I hope that yeah, you're not feeling quite so lost. I don't think you are lost. Some of you are very much on track. Some of you need a little bit of help, and once we get the information out, we'll be able to help those who need it most. All right, I hope that has helped you through this assignment. And just while I think about it, case study 2 will be the same as case study 1, except it's a more complex one. So with case study 1, I want a simple case with no more than 2 comorbidities. I don't want you getting tied up in knots over comorbidities. Let's get the process of the drug right, the process of assessment, the process of the condition and the pathophysiology and that sort of thing. Then the second case study, you can choose as complicated as you like. Just don't make it too complicated, because then you get yourself too wound up. All right, I hope that's helped you, and I hope we can move along and get through this. All right, thanks everybody.